The Women Advocate Research and Documentation Center is calling on the federal and state government to subsidize and include Tranexamic in all standards delivery kit in our public health facilities and ensure that this drug is consistently available at primary, secondary and tertiary levels of care. The group says this intervention should be done urgently so as to combat the high rate of maternal mortality in Nigeria. We have more.
A March 2023 report of the World Health Organization and the Integrated African Health Observatory ranks Nigeria as the third African nation with extremely high maternal mortality rates, recording 1,047 deaths per 100,000 live births. Experts attribute this alarming trend to the fact that only 43% of births in the country are assisted by a skilled provider, as more pregnant women opt for traditional birth attendants, TBAs instead, with 39% of births taking place in a health facility and 59% delivered at home. This heightens the need for Nigeria to do more to drastically reduce maternal mortality so as to meet the target of Sustainable Development Goal 3. This event marks the closing ceremony of the 12-month-long community-focused intervention called Project Transform, aimed at reducing maternal mortality in Nigeria through improved awareness, access and advocacy for the mass use of tranexamic acid, TXA, a WHO-recommended life-saving medicine for the treatment of postpartum hemorrhage, which has been linked to the high mortality rate in Nigeria.
So our contract with London School of Hygiene and Tropical Medicine is to create awareness in the community on the need for women to demand for medication that can support them from bleeding to death. For tranexamic acid to truly reduce maternal mortality in Nigeria, there must be system-level action, and it needs to be urgently required.
The NGO, working closely with community leaders, health advocates, civil society actors and media professionals, implemented the extensive community engagement and advocacy strategy across Lagos State. It says more than 20,000 people were reached through the various fora, while the digital and social media advocacy reached more than 5 million people globally. The findings helped to shape the resolutions for timely interventions by government.
They deliver at Quack's place, they deliver at CBA, because they said that they don't have access to the hospital during the night. We want government to exempt tricycle, especially when they are carrying pregnant women. Either they are going for the clinic or they are going for the delivery. They should allow the tricycle to ply the highway.
We have already told the TBAs, the registered TBA, that when they see any unregistered TBA, they should report them to us. When they report them to us, we take it up from there. And those people that are registered, they should do referral immediately when they see any woman that is bleeding after delivery.
To enhance maternal health, WATC is also seeking full integration of TXA into health protocols, continuous training for healthcare workers, strengthened supply chains, and increased collaboration for long-term impact. Kemi Foladeyemo, TVC News, Lagos.